Hi everyone, Dr. Oommen and I are back to answer more of your coronavirus questions. So today in Quebec we have about 628 cases, so we've seen a steep rise from the 219 we saw yesterday. A lot of this is due to more testing, and it's a really good initiative from the government to test more people, but it does give us a bit of a better idea of what kind of beast we're tackling here. So let's just get right into it, Dr. Oommen.
Okay, thank you, Dr. Liello. So my first question is here. My wife has 2 autoimmune disorders. We have 3 young kids between the ages of 1 and 8. If my mother and in-laws self-quarantined for 14 days, can they come over and visit my family? So my understanding is we have a wife and a young family here, and then a mother-in-law who's self-quarantined for 14 days. Can they come over to visit? And the short answer is no. So why is it like that? Because we said that those above 65 are in a high-risk category for mortality. But those under 65 who certainly have significant medical illnesses and autoimmune disorders that affect the immune system directly are considered significant medical disorder. So we have to think of this as a very high risk scenario for mortality. So around your wife, we want to build within your house this security perimeter within the house to isolate her from as much as possible yourself and the kids. So I would say it's a very difficult social situation, but no one else should be visiting.
It's a hard situation.
Yes.
So another question I got today was if I'm home alone with my husband and we're both well and we've been washing our hands, we come into the house from outside, do we need to wipe down all the door handles, clean the surfaces in the house? So it's a good question. In general, I think it's good practice too. I don't always have the time or attention at the end of the day to really think about all the surfaces that I've touched before I was able to get to the faucet and wash my hands. You know, you close the door, there's the door handle. You open the switch, there's that one. Then there's the faucet. So in general, it's just pretty good practice to wipe down all the surfaces periodically. That way you don't have to think about it.
Yeah, that's great advice. You have this routine, just follow the routine, don't think, eh?
Exactly.
Yeah, I like that. Here's the next one. It seems inevitable that we are heading towards some kind of lockdown. We have senior parents that are unable to care for themselves completely and rely on us to visit for various reasons. In the event that the government announces a lockdown, and considering we at home have stayed home, and they have stayed home, is it safe for us to bring them to live with us during the lockdown? Wow, what a high level, complicated question. We're getting a lot of these at different levels. So many layers to this. So I would say, from what we've understood so far, we have senior parents and they are dependent on their kids basically for some kind of care for, I presume, their survival. And should they be coming over in that scenario? And I would say there's many variables, but given the information we have here, it's probably the safest route. I would say that they're dependent on care, they're not fully autonomous, they can come into the house and live with their kids. And then again, we have to create within your house this security perimeter above, around the elderly parents, because their risk of mortality is high. We have to make sure that those that are going in and out of the house are staying far away from the parents. And the usual advice that we've given, and you could find in the coronavirus guide, is all the things related to self-isolation, meaning that they should keep 6 feet away from the rest of the family members. There should probably be one designated family member that's interacting with the parents to deliver the care, who knows the routine, who's going to be as hygienic as possible, and gloves if necessary, and you know, as much as you can, different bedrooms, different towels, eating at different times, washing everything in hot water. So it's okay for them to come over. My guess is that's the safest thing in the balance, but complicated. It depends so much on what the state of their health is, what's the state of the kids' health, how autonomous are they, what kind of self-care, is it a low level or is it life-saving critical health care, this care that they require. It is so many parameters, Dr. Liello.
And it's a huge responsibility now to become like a live-in caregiver. And there's a lot of work to it, like you were mentioning, but ultimately, if it comes down to the health of your loved one and your parents, I think it's worth it. Yeah. So another question with similar light to what you were discussing, should elderly people continue receiving services from the CLSC? So I think it depends on, again, a number of factors, primarily what the CLSC service is. So are we dealing with bathing? Are we dealing with just meal preparation? There's a huge range of services, and it really comes down to risk benefit. So if the person could do fine without these services, albeit a little less convenient, then it's safer to postpone those services. Or alternatively, if the person receiving the services also has another family member who you could now designate their caregiver and is going to be the same person doing the same tasks, helping them out, then it might be safer than that route, rather than, let's say, always having a different CLSC caregiver come into the house and possibly kind of expose you to different infections and things like that. I do understand that a lot of people receiving the CLSC services maybe don't have that additional help around, like through family or friends. And really, if the service is 100% kind of necessary, like it's your only source of meals, then really all you could do is try to maintain that social distancing, keep things at least 2 meters apart, always wash your hands, and really limit things to the absolute essential services.
Wow, the virus has really put us in an impossible position. There's no easy answers. There's no win-win solutions here medically. I have one here. We're getting a lot of this question for sure. How long do you think COVID-19 will remain a threat before we can defeat it and life returns back to normal again? Wow, this is really the billion-dollar question, and no one wants to commit to a number, but I could tell you that it is probably much longer than we all can imagine. So it depends on two key factors. It depends on how the self-isolation works, how good we are at self-isolating ourselves, and how much testing we could do in society to actually define who's positive and not. So you've all heard about flattening the curve. So we know that flattening the curve actually drags out the pandemic a little bit longer, but it allows us enough time by reducing the numbers spread over time. It allows us enough time for the medical resources and capacity to save more lives. So it may last a little bit longer, but we're going to save more lives and less deaths overall. So the first part of the answer is, how well can we self-isolate ourselves? And this is the critical period right now as we're starting to see the beginning of the explosive growth. And we really hope, Dr. Liello and ourselves, that people are heeding this message, because the only tools that we have at this point to save ourselves is to go into shelter in our homes and build a security parameter around the weakest members of your family, and a security parameter and a health parameter around your house. Part two of the question is, when can we get out of this self-isolation, is when we reach the level of serious testing. So we need to test. We need to test as many people as fast as possible. And then in many cases, we need to retest them. Now, South Korea is doing 20,000 tests a day. We're not quite there, and they have a mantra. We want to trace, test, and treat. And the only treatment we have at the moment is isolation. So you want to trace all the contacts. You want to test everybody. You may need to retest everybody in 14 days. And then you want to treat them with isolation. Because until that happens, in essence, we need to stay into lockdown. Because how do we know when it's safe to go back into society? Who is okay to go back into society? We only want to send those who are negative back out to interact. But if you're still positive, we have a problem of having this pandemic going on over and over again and continuing wave after wave. So in the absence of not testing, we don't know where the virus is. We don't know where the virus is hiding. And all we can tell you are these blanket statements for 8 million Quebecers to just hunker down at home for the long haul.
So, another question that we got. So, since it is believed that the virus was passed to humans from one or more animals, what precautions are necessary in regards to our pets? So, this is a great question. In fact, the CDC has not yet received any claims that pets or domestic animals could become sick with the coronavirus, with this specific coronavirus. And there's no evidence that pets could actually spread it to humans. So it should be noted that, currently no evidence in the middle of a pandemic doesn't really mean that they've been doing studies for this. It's essentially just means they haven't seen any cases of it thus far. What I would do is, especially if you're taking your dog out for short walks, of course, avoid dog parks, avoid interacting with other people, avoid having people pet your dog or your cat and just kind of interacting with your pet. Make sure that you're washing your hands before and after you go out, and before and after you have any interactions with your pets. It's difficult. Trust me, I have a golden retriever myself, and she thinks that I'm just this receptacle of love and affection, and it'll be hard to distance ourselves, but it's important. And it brings up a good point too. Everyone with a pet should have a contingency plan. So let's say, unfortunately, you do get the virus. It's good to maybe talk to family members or friends around you, someone that could watch the pet while you're kind of quarantined. It's important also to gather their medical records as well, their vaccine history, emergency numbers for the vet. You could also call the food stores. I know a lot of them are taking orders online just to make sure that you have enough food for your pet as well. So it's important that we focus on ourselves, but our pets are a large part of that as well.
Wow, that's so true. And so I thought maybe we'll end like this, talking a little bit again about the R0. So the R0 was a concept that Dr. Liello mentioned 2 videos ago. Can you remind us, John, about that?
Sure. So the R0 is essentially how quickly the virus spreads. For the coronavirus, for this specific coronavirus, it was around 2.2, meaning any one person infected could spread it to at least 2 other people.
So that's a very important point. So another way of looking at that is, we believe from what we've learned so far from China, Asia, Europe, that the doubling time of the COVID-19 virus is about 4 days. So if we do the math from where we are today, theoretically in 48 days, 8 million Quebecers, that's everyone, could be infected. Now that won't happen for many epidemiologic and medical reasons, but there is estimates that about 50% will be infected. So you could do the math yourself and you could see why we are speaking to today and why we'll continue to do so every day. The other 50% that didn't get infected were for various reasons. A big part of that was that they isolated themselves fast enough and long enough. And this is everybody from 0 to 100 and beyond. There's no exceptions anymore. There are deaths now at all ages. Now, if you look at the mortality rate, at the moment, we're guessing somewhere between 0.7 and 3.4%. So let's say, Dr. Liello, about 2.2%. So if it's 2.2%, and we have this kind of exponential doubling time, about 80,000 Quebecers could die in the process. So to put that in perspective, we're gonna fill the Bell Center, we're gonna empty it out, we're gonna fill it again 4 times. That's how many people are gonna die. So we need to act fast. So I had a thought, and I thought maybe we could think of it in this fashion. So in the next minute, after this video ends, if we start with the base of people that are currently following us on social media. So if we have our average followers now from Facebook, YouTube, Twitter, our website, if we start with our base, and in the first minute after this video ends, if they all call 2 people, and in the following minute after that, those people called 2 people and told them to self-isolate, because that's all we have, remember, until the government gets us test. And then in the following minute, those people call 2 people. I've calculated here that we will reach 8 million Quebecers, everyone, in less than 13 minutes. So we can stay ahead of this, we can flatten the curve, we can beat the doubling time, and that's all we've got to tell you.
All it takes is 13 minutes.
Thank you. Yes.
Stay safe.
Stay safe.